Hello and welcome to the Health Channel, all health all the time. I'm Laura DeAngelis coming to you from the Baptist Health South Florida studios in Coral Gables. And right now we would like to introduce you to Roxy and April. These are two sleepy pets that unfortunately can cause big allergy problems, and my apologies to those cuddly little creatures there, but you know, like obesity, allergies are a common health problem among children and teens these days. Now joining me today to talk about allergies and asthma is Dr. Javier Hiriart, a pediatrician and family medicine physician with Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. Dr. Hiriart, we are so glad you are with us today to walk us through the hour and talking about allergies and asthma and why we need to worry about it.
Thank you, Laura. It's a pleasure to be here. Thank you for having me.
Absolutely. Okay, so doctor, let's just kind of start off right getting into it. Tell us, what is an allergy? What is allergic rhinitis?
So, allergic rhinitis is a manifestation of an allergy, but an allergy in general is when the body has become sensitized, usually to something external. So it could be anything from those cute little pets to things like dust or roaches or things like perfumes, fragrances, trees and grasses. So when the body becomes sensitized to those things, it develops an antibody, and it tends to kind of cause a series of symptoms and effects that we see in the body.
Yeah, and unfortunately they're everywhere, these triggers. And doctor, we actually have something on BioDigital that you might be able also to reference to kind of tell us how allergies can affect us.
Absolutely. So specifically, when you relate to allergic rhinitis or the manifestations of allergies in the nose and the upper airway, you can see some of the parts of the bodies that are affected. So it can manifest from as simple as the simple sniffles, right? So you get that inability to clear the nose, congestion, sneezing. It can also manifest as an itchy or sore throat, post-nasal drip. So also you can see that you'll have some of the effects of sinusitis. So you can get fluid trapped in those sinuses. And even sometimes, not directly rhinitis, but sometimes eye symptoms. Conjunctivitis can also be very bothersome. So not in this graphic, but you can see that the whole upper airway really can be affected by that.
Yeah, and again, it's just uncomfortable feeling all around. I mean, the areas you're talking about, I mean, can see why allergies can really wreak havoc on us. And we also know that there are some common risk factors when it comes to allergies, and those can include having a family history of asthma or allergies, if you are a child, and if you have asthma. So, doctor, I guess based on those risk factors, let's also kind of talk about how allergies and asthma are kind of related.
Yeah, they are linked in a way, is that sometimes we see that people that tend to have allergies can also have asthma because they have a link in that they have common pathways that they can manifest. So not everybody will manifest all of those symptoms, but you can see some of the common triggers that may cause allergies in one person could cause asthma in somebody else.
Okay, and I should also go back to family history was listed as one of those risk factors. I mean, is it necessary to say that, well, mom had allergies, so I probably will too, or is it very common?
You commonly will see genetic or family predispositions, but it's not an absolute rule that if your mom and dad had an allergy, although there is a higher chance if mom and dad have had allergies or asthma that your children can definitely have it as well.
Okay, so we talked about couple of those risk factors. We talked about the relationship, if you will, between possibly allergies and asthma, but let's also talk about some of the triggers, or again, get more into those. We have several of them. We can talk about airborne, foods, insect stings, medications, latex or other substances. So, you know, again, doctor, they seem to be everywhere. So what can you say about some of those triggers?
It's absolutely true. I mean, that list included a lot of the top ones. And so it can be as simple as indoor things that you find in every home, dust mites, dust. We talk about reducing the load of those if you can, and we'll talk about that at some point. And also things like stepping outside, so in certain seasonality to it, so grasses, molds, pollens in certain seasons. And you'll also find that pets, fragrances, and sometimes even things like insect stings, like you said. And the gamut of allergies can also run, to the point of a reaction that can be as severe as like an anaphylactic reaction, which obviously is the most scary and severe, allergic rhinitis being much more mild on that spectrum.
Okay, and speaking of on the milder side, again, sneezing, not always a sign of the common cold. It is definitely a sign possibly of having an allergic reaction. So what are some of the other signs that it could be, again, an allergic reaction that you're dealing with?
Right. So sneezing is not is a common manifestation of a cold, but a lot of times you're correct, it's not.
Yeah.
So you know, the itchy, watery eyes, the scratchy throat, the clogged, you know, itchy ears that need to clear your throat. You know, those sniffles, clear kind of sniffles that you don't really kind of get rid of, but that, you know, and seem to come and go. And you notice, you know what? Every time he plays outside, he's more sniffly than when he comes inside. So you'll see some of those things absolutely as common allergic rhinitis symptoms.
Okay, and Doctor, how is it too that you diagnose that someone even has these allergies? I mean, I think a lot of people maybe once in a while they are sneezing, having some of those other symptoms that you talked about, but how do you actually diagnose when someone has allergies?
So allergies are really clinically suspected. So a lot of times based on the history and the physical, you'll kind of get the sense, you know, this repetitive trend to see these symptoms and not be related to a fever or an actual, you know, cold or anything. A lot of times people will say, I feel okay, I just keep getting these recurrent symptoms. So that'll be kind of the hint. And then you don't necessarily have to do a lot of testing. A lot of times we'll just treat somebody with medications that are appropriate for allergies, but sometimes it is a good idea in certain situations and depending upon how severe the symptoms are to actually get more testing done.
Okay, and actually just on a personal note there, I did suffer from a lot of allergies younger, and they did those tests that you mentioned. So talk a little bit about those tests. I had those sticks, if you will,
That's
put in
right.
my arm to see kind of what I reacted to. Unfortunately, my arm was one big balloon by the time they were done. But why are those tests necessary, and how do they help you diagnose what's going on?
Right, so sometimes those are a good ancillary thing, especially if someone's having, like I said, more frequent severe symptoms. So you can do skin testing or you can do also blood testing, and both of them will help to identify maybe more specific triggers for the allergies. So for some people, like I said, it could be environmental. For other people, it could be anything as simple as medications. It could be pet dander, or even finding out if they're related, if they're very severely allergic to bee stings and other things like that. So in some situations, it can really be helpful to help determine how severe the symptoms could be and what kind of treatment would be necessary.
Sure. Doctor, you just brought up a term which is important. Unfortunately, too, I'm allergic to dogs and cats, like the cute ones we saw at the beginning of the show. And you just mentioned pet dander. So what is it, too, about pets or a feature of a pet that may trigger an allergy? And you know, some dogs, we call them, I guess, hypoallergenic. So can you just tell us about pet dander and how that can be a trigger for people with allergies?
Sure. You know, like any other trigger, pet dander is, you know, it becomes aerosolized and people become sensitive to it. If your body has developed that kind of reaction to it, you'll see, like for instance, I had a personal experience. I'm allergic to cats. I went to a friend's home. I sat in the wrong chair. I didn't know why I was all of a sudden itchy. And then they told me, oh, that's a cat's chair. And so, you know, once you're sensitized, you can kind of have that when you have a repeat exposure. It becomes more easy to kind of have that reaction again, those symptoms. So, and pets, unfortunately, it's like you said, some of them have less shedding of hair and less shedding of the dander. So those hypoallergenic types of breeds sometimes are better for people that are sensitive to them.
Right. I can pet poodles. I have no problem with that, which is a good thing because I do like them a lot. Doctor, one thing too, again, triggers all around us, but some of them are all year round triggers, and then we also hear about seasonal triggers or, you know, seasonal occasions of that. So can you also explain what a seasonal trigger might be?
Absolutely. For certain people, their symptoms are year round, they're perennial, but some people, especially in parts of the country that are more, you know, have true seasons where flowering shrubs and trees are more common, they'll notice that, oh yeah, I'm definitely a spring or a fall allergy person. So certain allergens that they're more sensitive to. For instance, down here locally, some people will say, I know when it's mango season. It's not because the mangoes are ready to eat, it's because the flowers are out and I'm all of a sudden sneezing and having allergies again. So
wow.
I have a few patients that say, I like the mangoes, but I like them in the store, not when they're getting ready to be in Publix.
Those poor flowers. Okay,
Yeah.
I got you. Now, as far as, Doctor, once we do figure out that someone's suffering from allergies, how can we treat them? A lot of different ways, I know, so tell us about that.
Absolutely, and we try to tailor the treatment actually to what the most worrisome symptoms are or bothersome symptoms are. So there's lots of different medications we can use. If you have more eye symptoms, we might go more with eye drops. If you have more nasal symptoms, congestion, runny nose, post-nasal drip, we may go more with like antihistamines that are oral. We may go with nasal inhaled steroids, and there's also different medications that may help to stabilize the kind of cells that mediate allergies. So we have multiple prongs we can use really to attack the symptoms of allergies and try to mediate them and kind of minimize the symptoms.
Okay, and really important too, I think, Doctor, is when should a parent consider it's time to take their child, their teen, to see the doctor? You know, not to just say, oh, well, they're just sneezing once in a while, but when is it time for a parent to bring the child in to get checked out by you?
Yeah, it's a good question in the sense that a lot of times we see these parents, these children come in, and it's not so much because they're thinking allergies, they keep thinking that they're having colds, they can't shake this cold. And sometimes that is the case, but so I think when you feel like your child is, you know, why can't they shake this cold? We see that a lot, but I think that if you're not sure, that's always a good reason to get checked by the doctor. But also when you're not really sure, especially in younger children, what medications can I even use? Because I know I can take certain medicines, but maybe I can't give that to my child. So it's really a good idea if you're not sure, especially in younger children, to make sure, number one, we're treating the right thing, and number two, that we can tailor the treatment to your child's symptoms as well as to what would be most effective based on what they have.
Okay, very important to be safe, Dr. Hiriart. Good point there. Okay, we're off to a great start. So when we come back, we're going to talk to Dr. Hiriart about asthma, which is the leading cause of chronic illness in children. And you can always check out our website, allhealthallthetime.com. You can submit questions for the doctors and find out more about all the programs here on the Health Channel on South Florida PBS. Don't go away. We're coming right back.
The Alter-G can be used for everything from athletic population, from young kids, high school, college, professional athletes, all the way to our older populations coming in with hip replacements, knee replacements. When you get into the treadmill, they wear a special spandex pants that has a zipper on it. You zip them in. When we turn on the treadmill, it fills up with air. It goes through a little process where it kind of gauges how much the patient weighs. It starts you at 100%, and then from there, we bring them down at that point.
I run track and cross country at St. Brennan, and my knee, I started getting knee pain in like January, so I stopped training and I started coming here. It's been good because I've been able to start running before I can actually get cleared, so it takes like the weight off my body, so it doesn't hurt as much when I run, and I can start running and getting used to like the motions and everything again before I can actually go out and train hard.
When the patient gets in it, usually they're always a little bit apprehensive, but in general, the patients usually like it a lot.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health all the time. I'm Laura DeAngelis. Well, some people say having asthma feels like breathing through a straw. That's because the airways in the lungs swell up and fill with mucus, which causes the airways to get smaller. Well, Dr. Javier Hiriart, a pediatrician and family medicine physician with Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital, is here to help us understand the disease and how to help your child or teen live with asthma. So again, doctor, this is a pretty prevalent problem. Actually, according to the Centers for Disease Control and Prevention, asthma affects 1 in 12 children ages 0 to 17 here in the United States, and among those living in the cities. So doctor, we just mentioned living in the cities, there's smog, there's pollution to think about, but what are some of the other factors that could make a child or a teen at risk for developing asthma?
Sure, so things like air pollutants certainly are, like you mentioned, could be a factor. Genetic predisposition, like we mentioned earlier in the show, so things like family history. And then allergic tendencies. We'll sometimes see links between like allergic rhinitis, eczema, and asthma. So those people are more prone to develop asthma because it's a manifestation of kind of allergic tendencies. So.
Okay, so there's a whole variety of factors that can definitely trigger it. And there's also a lot of there's symptoms involved, of course, with having asthma. And so we want to mention what some of those might be. We have the coughing, especially at nighttime perhaps, wheezing, shortness of breath, chest tightness, pain, or pressure. So doctor, again, is this really kind of the most common symptoms that maybe it's time to talk to your doctor about your child or teen's symptoms about asthma?
Absolutely, those are pretty much the cardinal signs and symptoms you look for in asthma. So that was very accurate.
Okay, so good to know, dead on there. Now, the other thing, again, doctor, we've talked about the prevalence about asthma, and I guess my question is, though, how do you diagnose that asthma is what someone is dealing with, and what do you kind of rule out before you even make that diagnosis? Sure,
so that's a great point. Not one-time wheezing makes you an asthmatic, so that's a very important point.
Okay.
But when we see a repetitive pattern to different stimuli, it could be something in the environment, it could be catching a cold, it could be weather changes, it could be exercise. So when you see a repetitive pattern of these recurrent symptoms that we just saw, the chest pressure, the tightness, the cough, the wheezing, when you see a repetitive pattern and then you actually are able to document the parents telling you, I hear that kind of musical high-pitched sound, that wheeze, or I hear like that cat meowing, or the doctor actually listens to it. That really sets you up to really suspect asthma, especially when it's on a recurrent pattern and recurrent kind of intermittent, but recurrent kind of episodes happen.
Okay, so again, a lot of different things to look for. Like you said, one time doesn't necessarily mean that, but also it's probably something you talk about are the triggers that might be leading to this problem. And when we talk about the triggers, we're talking about things like tobacco smoke, respiratory infections. We're also, actually right now we're talking about some of those triggers for kids at school, so hopefully no one's smoking at school, but we may have things like the teacher's perfume, classroom animals, if there's any pets, sometimes I know rabbits get brought in, even pests. So talk about again how these triggers can even be in a school environment.
Right, so in any environment, so school is one place and our kids spend many hours a day at school, so obviously managing asthma, not only at home, but looking at everything in in the environment. So looking for things that could happen in the school are important. So even something like PE, right? So we talk about exercise as a trigger for some people having asthma, and exercise-induced kind of spasm, bronchospasm. But again, it's kind of, when you think about asthma, it's that recurrent pattern that happens, and it's noticing that in between that they're fine, and it's looking for those different triggers. So bringing up school was a very important point for people, because kids are kids, just like we spend a lot of time at work. That's where they spend a lot of their time besides at home.
Okay, so we've talked about, now you've diagnosed the situation, and we know that a child might be going through asthma. So doctor, why don't you kind of walk us through what happens during an asthma attack? And we actually have a biodigital image that you can kind of help show us what is going on.
Absolutely. So as we look at the graphic, you'll see that this is kind of what happens when everything is great. So the muscles of the breathing tubes, the bronchi, are open, and there's not a lot of secretions. The airways are nice and open. Everything is nice and relaxed. So add to that any sort of trigger. You catch a cold, cold air, perfume, your teacher's perfume, and all of a sudden everything starts to change. So you get the trigger for smooth muscle in the airways to kind of start to constrict. You're getting your bronchospasm. You get the inflammatory mediators from the inflammation that's part of asthma to start to produce more mucus, more secretion. So now you've got a smaller airway because it's smaller in diameter, plus you have stuff clogging it up, right? You have mucus clogging it. And then on top of that, you have maybe ongoing exposure. So now the child's already coughing, and now they're starting to feel even more anxious, which can also be a trigger to continue to kind of make things get worse and cascade on. So some of these will be hints as to the different ways we attack the asthma, and trying to attack the different things that are causing that airway to kind of close up.
Okay, and doctor, you just kind of walked us through what happens there, talking about airwaves getting tightened up, if you will, that feeling of breathing through a straw like I referred to. And I'm just curious, do more boys than girls experience asthma, or how does that compare?
There's some disparity, because we'll see that before puberty, it's more common to see asthma in boys and girls, but then it's also more common in adulthood to see more women than men. And there's no real sound reason that they've been able to find as to why that happens, but we do know that asthma is multiple different things playing a role, so we may not be able to find that one link that tells us why boys earlier in life have it before puberty than girls, but we know that we can look at the different factors that could be playing a role in producing asthma and individualize that plan.
Okay, and doctor, as far as how severe of a situation you could be facing, how common is it for a teen or a child to have to go to the emergency room to be treated for asthma, and why might that happen? When is it time for a parent to get their kid to the hospital if they're undergoing an asthma attack?
Asthma is a scary thing. The sensation that you can't breathe is not comfortable at all. And for an asthmatic, especially when they start to learn their triggers, they'll know when they're starting to get bad. But our goal, obviously, in primary care and in general, is to avoid people having to get to the point that they get to the emergency room. So we try to put a plan in place before that. But it is still one of the most common reasons people will seek care, not only in the emergency room, but also in the outpatient offices. So we try to educate not only the patients and the kids as they get older, and the teens especially, that become hopefully more independent in their care, but also the parents in how to help guide them along to avoid triggers and to institute care as needed to hopefully prevent you getting from a mild attack to a severe attack.
Okay, and obviously prevention is going to involve having some medications on hand that can help with the situation. So let's talk about those treatments, doctor, and again, the efforts in avoiding that trip to the emergency room in some kind of a dangerous situation.
Sure. So one of the things I always like to talk about with asthma and even allergy treatment is not medication. It's very important to take medication, but things in your environment that you can modify that will help to reduce your symptoms. So for instance, if you have carpeting in the home, making sure it's as clean as possible and vacuuming it. If you have air filters, air conditioning filters, or furnace filters, making sure you change them off and making sure if they're replaceable, you replace them, or you clean them if they're not replaceable. Making sure you keep stuffed animals. A lot of kids like to sleep with stuffed animals, but keep them out of the bed. These are common factors that we know help accumulate dust and dust mites and extra allergens. Covering the mattress and the pillowcase sometimes in impermeable allergenic covers, because it reduces reduces that exposure as well. So non-pharmacological, non-medication things are an important thing to always think about including. And then of course we always like to attack the symptoms with medication, and we kind of talked a little bit about how the airway closes up, so we like to attack with like bronchodilators, so something like an albuterol to help open up that smooth muscle, right, so that the airway opens up. And then we like to also deal with, depending on the severity, but we also like to deal with anti-inflammatories, because we're aware that asthma is not just the bronchus closing up, it's also an inflammatory disease and mediated by factors in the body in a cascade from sensitization. So if we attack with anti-inflammatories, things like, you know, steroid inhalers or even oral steroids if it gets to be worse, those are the kinds of things that we'd use to kind of attack the different prongs that are causing the asthma attack.
Okay, so obviously a lot of different things in place. And real quickly, doctor, exercise can sometimes trigger asthma. Is it important for some of these kids to limit activity, or just a real quick note on that?
Yeah, exercise-induced asthma is a common type of asthma that we see, but we don't really like kids to not be active. So unless they're in the middle of a bad attack or a flare, they've got a cold and their asthma's flared, we don't like to keep kids out of activity. What we sometimes like to educate them on is you may be the kind of child or teenager who needs to use your inhaler preventatively before you start exercising, so you don't develop those symptoms during. But as much as possible, especially in today's day and age where kids are behind screens a lot, we really, really want to keep them active as much as possible.
Okay, active and safe about it. Okay, sounds good, doctor. All right, well, when we come back, we're going to, speaking of children, we're going to find out how to control asthma and those triggers when your child or teen is at school. And please be sure to visit our website, allhealthallthetime.com, to submit your questions and learn more about the Health Channel. We'll be right back after this quick break.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Intoning is basically when your child comes in and walks with their feet pointing towards the midline. Most people walk with feet out about 10 degrees, pigeon toes with the foot inside. Intoning is very common. It's by far one of the most common reasons for us to see patients in the office. But most pediatricians do a very good job at telling you if there's something more that needs to be done. It can come from 3 different places. It can come from your thigh bone, your tibia, or your foot. And any one of those things can be curved to cause the foot to progress forward. We now know that this condition improves on its own. It doesn't cause any lasting issues, no arthritis, no other joint issues or bony issues. And the bracing can actually cause weakness that can maybe even delay the progress of them getting better on their own. More than 90% of these kids will outgrow this, absolutely.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions, like how much vitamin A is good for you and how much is too much. If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
Hello, I'm Dr. Jose Sosa with Baptist Health Primary Care. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Welcome back to the Health Channel, all health, all the time. Coming to you from the Baptist Health South Florida studios in Coral Gables. We've been learning a lot this hour about allergies and asthma with the help of Dr. Javier Hiriart, a pediatrician with Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. Now, doctor, we have talked a lot about the signs and the symptoms of asthma, and now we actually have a video that can help parents of children and teens control the asthma in their kids. So let's take a look.
Hello, I'm Dr. Lester Caradegas with Baptist Health Primary Care. Using what you know about managing your asthma can give you control over this chronic disease. Controlling your asthma will help you breathe easier, be as active as you would like, sleep well, stay out of the hospital, and be free from coughing and wheezing. Successful asthma management includes knowing the warning signs of an attack, avoiding things that may trigger an attack, and following the advice of your healthcare provider. Use your asthma medicine as prescribed and be aware of common triggers in the environment known to bring on asthma symptoms. These include smoke, household pets, dust mites, and pollen. The important thing to remember is that you can control your asthma.
Well, doctor, as we saw, there are some ways that we can control the asthma. That's great news. And why is it so important for parents to have an action plan at home? Let's start at the home when it comes to their kids and asthma.
There are some excellent points that he brought up, and so certainly avoiding the asthma action plan that you can put in place, it should be individualized, and it is vital because, you know, we like to divide it into green, yellow, and red, right? So for kids especially, it puts a little stoplight fun into it. But so green zone means you're doing well, yellow is caution, and red is, you know, you're starting to get into more severe things, you need to take even further action. So it's important because prevention is always part of that asthma action plan, and then when things are going well, you're in the green zone, then you don't have to do much. But you always want to step up the care and always know based off symptoms, and also for older children that are doing things like peak flow meters where they can read and see what their numbers are. If they start to see a decrease in their peak flow before they even get to the point of having symptoms, that also can be another reason to step up their action plan and go from maybe green to yellow or yellow to red. Certainly the most important part of that, whatever the individualization of that plan may be, is to follow the steps and to communicate with your doctor's office, because if you're having to go from one step to the other, that may be the time to especially communicate, maybe try to set up an appointment to come in, so that obviously we can kind of nip things in the bud and try to hopefully not get to the point that people need to get to the ER.
Okay, and doctor, just to follow up, you mentioned a peak flow meter. Is that something you would have to breathe into, or what is that kind of a meter that the parents
especially
are using?
in probably children, probably by the age of 5 or 6, they can start to do it. It's just a simple device where they'll just breathe into it, and sometimes you tell them do 3 to 5 and see what their average is, and then when they're doing well, and then you know that's kind of what their good airflow is, right? So when asthma symptoms start to come in, and you start to get a little bit of that tightening of the airway, you'll start to notice that'll decrease. So that'll be kind of like an objective way, besides the fact that they may not be feeling well, that you can kind of measure, you know what, you're down, 50 mLs on your peak flow. You're down, you're starting to decrease, so we need to institute action and start to be more aggressive in your treatment.
Okay, good to know. There's a tool you can have to help measure that and then figure out if it's that red, yellow, or green zone that you're in. So we've talked about the action plan at the home, which of course is very important, but we know that, children and teens spend a lot of time in school. So obviously it's very important to consider an action plan there as well. And we actually have a list of what you can do to actually get that action place in plan when we go to school. So here we go. We've got the 4 steps, doctor, and talks about sharing your child's asthma plan and get the teachers, the coaches, the school nurse involved in that. fill out all those forms that they give you so that they know about the asthma medication that can be given. You know, maybe go check out the environment yourself. If do you notice mold or mildew? And of course, develop a relationship with that school nurse. So, you know, doctor, again, your take on those steps, and again, kind of why they are so important to getting that action plan in place.
I agree. I think they're all excellent suggestions and steps. Certainly knowing if your school, your child's school has health staff actually on site, on premises, that's important to connect to, because that'll be your go-to person or your child's go-to person if they're starting to have symptoms. But certainly making sure that the forms are filled out so your child has permission to either self-administer their inhaler if they need to, or so that they have permission to go to the school nurse to get that administered. But you know, I think those are excellent suggestions to make sure, like I said earlier, your children are at school for 7-8 hours a day sometimes, and they can be exposed to things that could trigger them, or if they have a mild cold, they could get worse during the day. So you want to make sure that that can be managed and not wait till they get out of school where maybe it's gotten worse.
Yeah, absolutely. It's a team effort. As you said, they might have triggers in the school, in their classroom. And again, to talk about those triggers again in the school, we mentioned check it out maybe for the dust, the mold, the mildew. Check it out yourself perhaps. And then some of the other triggers, again, in addition, we've talked about the air fresheners, disinfectants, even a teacher's perfume, right?
Right, and it's hard to control all of those factors, unfortunately. But I think nowadays people are much more sensitized to, you know, maybe avoiding strong odors, and even with some of the food allergies, avoiding certain things in the general environment. So I think that that's an important thing, although we can't control everything, but certainly we can, you know, try to have them minimized. And I'm sure that a lot of times now schools are more sensitive to the cleansers and the things that they use not being, you know, as strong of an odor, so that it may not trigger anybody's allergies or asthma.
Yes, I think a lot more people are aware nowadays. I know schools are trying to do what they can to make it a safer environment, if you will, for a lot of different children. Now, let's talk about whether they're at home or whether they're at school. I mean, we know kids can get excited. I mean, that's just part of an emotion we go through as kids. So let's talk about how different emotions can also possibly trigger something like an asthma attack, or just, you know, other reactions make it worse.
We see that, and it's true. You can have people that they get nervous and they start to say, oh, I'm wheezing, or even a good emotion, getting happy sometimes, or very excited about, you know, something great happening, or getting a good grade, or sometimes nervous before a test, right? So all of those things are things that sometimes will kind of, in some people, produce that emotional component, and they will start to feel like they're getting tired or they're wheezing. So certainly there's a link for some people with that. And so, well, the avoidance there is, what do you say? Don't get too high, don't get too low, but that's hard to do sometimes, right? So,
absolutely.
But definitely there's a link, and so we say to people, if you can, try to you know, always have your rescue inhaler with you, so that way if you have emotional issues arise or something else trigger your asthma, you're able to kind of take action.
Okay, and we're putting all these plans in place, talking about the different triggers, coming up with an action plan at home and at school. I guess another thing is, should parents think that their child could outgrow asthma? Is that something that happens? What's the reality of that?
There's certainly a possibility. I mean, we used to say, oh, a lot of people will outgrow the asthma, and whether they truly outgrow it or not, you know, maybe the debate's still out a little bit, because we see a lot of adults sometimes that say, I haven't had asthma since I was 10, and now they have asthma again all of a sudden, and it's not COPD or anything else. So there are some people though that definitely will kind of seemingly outgrow it, and they'll have years maybe with no recurrence, or maybe no recurrence at all. So I think there is a component of people that will have that kind of, like, they've outgrown it.
Okay, well, that's something good to look forward to, I guess. And is asthma pretty much the same whether you develop it as a child versus someone older, like a teenager? I mean, are the symptoms pretty much the same for all? Does anything change based on age, or?
I think that some of the cardinal symptoms are the same, and certainly the wheezing is one of the cardinal features and the physical findings. But I think it's harder sometimes in some of the younger children, you know, the 2, 3, 4-year-old, because they don't complain sometimes of their chest feeling heavy. They just may not be as active, and sometimes what you'll notice is they're coughing at night, or they kind of just have repetitive cough, and you won't really hear the wheezing. So sometimes in younger children it's a little more subtle, and it takes a little bit more to tease it out. Or, you know, maybe the mom will say, you know, he was sleeping through the night, and now, you know, every time he catches a cold, you know, even when he's over the fever and everything, he keeps coughing, and he's waking up multiple times per night. So looking for things like nighttime awakening and cough that we really can't explain, maybe a little bit more of a clue for younger children.
Okay. Another thing too, just for the parents again watching who, you know, they've seen their child suffer through asthma, or they're not even sure about it, what would you like to say to reassure them that, again, there are treatments available, and there are ways to get it under control. So just a little note of reassurance for our viewers who are worried about their child or their teen, and maybe they've just been diagnosed with asthma. You know, what would you like to say to them?
Absolutely, Laura, that's a great point. I mean, I think that we all would worry if our child has anything, and asthma can be very scary, but can also be very well managed. And I think that educating yourselves on what asthma is and allergies, and also learning what triggers could make your child's symptoms worse, and knowing that there's so many treatments now, both non-medication and medication, that we can use to help manage the asthma, to help your child live as, you know, a pretty much normal life, is really the key here, is to manage it and to be able to handle it so that your child is able to be active and live a healthy, productive life.
Okay, that's a good, again, positive news here. It is manageable. It's just really about having the knowledge, speaking with your family physician about what your options are, and having those action plans in place, right?
Yes.
Okay, and also always having the medication at hand. That's important, right? Remember to take it with you
Right.
if that's what you're using, obviously.
Right, it's good to have that albuterol or the rescue medication handy just in case symptoms do arise, and also knowing the difference if your asthma has maybe gone from a lower category to something that's more persistent, then maybe making sure that you use your controller medication consistently and correctly rather than as needed, and knowing the difference between the rescue medication like the inhaler, the albuterol inhaler, and the controller medication like the inhaled steroid or something along those lines.
Okay, Dr. Hiriart, all great tips on how we can get those action plans in place and really help manage asthma in kids and teens. So we're not done though. We have some more information coming up, and we're going to have tips for controlling your child's asthma through the years. And also be sure to visit our website, allhealthallthetime.com, to submit your questions for all the doctors here and to find out all about what's on the Health Channel on South Florida PBS. Stay with us. We're coming right back.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. We are winding down this hour on allergies and asthma with Dr. Javier Hiriart, a pediatrician with Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. And Dr. Hiriart, we've been spending a lot of time in this past hour talking about the symptoms, the triggers related to asthma when it comes to teens and kids. So again, just to kind of bring it home a little bit, how can their parents help their children live with asthma?
So basically, modify things in the environment, in their home, school, like we've talked about, that they know maybe are things that can help trigger their asthma and their symptoms. So modifying those things, and then making sure they've developed a good action plan that works for them and their family with their doctor, and making sure that they discuss that with their doctor. Whatever that plan may be, that will work for them, and also having good open communication with their doctor so that they're able to know what are the warning signs. I've gone from one step, green to yellow or yellow to red in my action plan, so that I know what the next steps should be.
Okay, speaking of discussing things with the doctor, what other tips can you just offer to parents about really getting the most out of their visit with their children, with their family practitioner who's taking care of their child?
So, I mean, one of my big things is always to advocate for parents to be prepared for the visit. If you have questions, I mean, we all know we go to the doctor and you blank out, right? You may forget what some of the questions may be. So maybe if you have some concerns or questions and you need to, take notes. Maybe make a note on your phone or actually write them out so that you remember to bring up any concerns you may have. And also, one of the major parts of the visit, especially as your child gets older, will be to try to, have the child take the lead on, kind of developing that independence. And, we know that we can make children take medications, but as they get older, it gets harder and harder. And we really want to have them kind of be the lead, and we support them. The doctor and the parents support them in kind of like knowing what your symptoms are, knowing when to start taking, another medication. So kind of empowering the child and the teen to kind of help themselves, kind of be the lead as well.
Well, it's, again, like we all know, we're our best advocate when it comes to our health care, so teaching the children early, definitely a good thing.
Absolutely.
All right.
Absolutely.
Well, doctor, we're actually going to go back to two of our friends we saw in the beginning of the hour, and that was Roxy and April, those little cuddly creatures. And, we talked about triggers, and a big question for parents may be, do we keep the pets around? So let's find out the answer from primary care physician Agata Hernandez, see what he has to say.
Hello, I'm Dr. Agatha Hernandez with the Baptist Health Primary Care Family Medicine Center at West Kendall Baptist Hospital. Everyone loves the family pet, but sometimes they can trigger asthma in individuals with an allergy to animal dander. The most effective method to control animal allergens is to not allow animals in the home. If you remove an animal from the home, it is important to thoroughly clean the floors, walls, carpets, and upholstered furniture.
That's very interesting. Doctor, your colleague there brought up a good point that, and you actually mentioned this earlier, that it's not just the actual animal itself. You're talking about the areas that the animal has been on, the couch, a chair, the bed, the carpet. So again, just remind us about how that trigger can really spread throughout the house when a pet's involved.
Yeah, it almost becomes ubiquitous throughout the home, right? So unless the pet is literally restricted to one section of the home, and even then, if you go play with that pet and you go outside of that room, you're going to be spreading that dander, that allergen throughout the home. So if someone in the home really does have a bad allergy to unfortunately to Roxy or to April, then you're going to need to really consider having them be an outdoor cat or an outdoor dog.
Right. And another area to think about is the car, right? If you let the pet travel in the car and now you're taking the kid to school or some activity, could that be a trigger as well?
Absolutely. I mean, the dander stays in the fabrics, the carpeting. So again, it can be another risk of exposure to that allergen. Absolutely.
Okay. And doctor, as we get into, we've been talking about ways to manage or help manage the asthma that your child or your teen might be suffering from. So let's talk about some of, I guess, the long-term action plans, some of the medications that might be involved if it gets to that level.
Sure. So, we tend to divide asthma, into classifications, and, The mildest one is just mild intermittent, so they have intermittent symptoms. And then in a broad other category are the persistent. And we grade them out based on how severe the symptoms are, things like cough, wheezing, how frequently they're needing to use their inhaler, rescue medication like albuterol, as well as things like how often they're waking up at night. And if they're old enough to do, breathing tests like peak flow and spirometry, that also helps us classify the asthma and severity. So for the mild intermittent, we're really talking about having your albuterol available, your rescue medication as needed, right? But once you're getting to like the persistent, what you're referring to, these long-term or controller medications, can vary from things like inhaled steroids, nebulized or inhaled steroids, that will help to reduce that inflammatory kind of cascade of cells that cause the increased production of mucus, the increased inflammation of the airway. Kind of like when we were talking about that airway closing up, the albuterol will help relax that smooth muscle and open up that breathing tube, that bronchus. But you need sometimes, when it's more persistent, these, for instance, inhaled steroids that help decrease the inflammation, decrease the mucus production. Another type could be a pill like something like montelukast, so to attack a different inflammatory marker called the leukotriene. So there's lots of different pathways and ways that we can kind of manage asthma that's become more persistent. And the key there is to make sure your patient and the parents understand that when it's a controller medication, it's really meant to be used all the time, not just when you're feeling bad, and it's to help prevent you from getting worse and needing to use your albuterol.
Okay, the pill that you just mentioned, I think people are very familiar with inhalers. We hear a lot about them and see a lot of ads for them, if you will.
Sure.
But the pill that you just referenced to, how does that work? Is that a version of a steroid, or is it something totally different?
It's different. It's a different mechanism. It helps decrease inflammation in a way that works through a different pathway. It's called the leukotriene. Is a chemical that the body produces that helps to cause, similar to histamine, so a leukotriene is different. So an antihistamine will work by blocking those receptors and causing, when histamine gets released in the body, it causes a lot of things we see, the sniffles, the watery eyes, the sneezing. So the leukotriene is a different chemical that the body produces that also will cause inflammation. So just like you can use antihistamine, you'll use things that block the leukotriene effects, and that's something like the montelukast that I mentioned.
Okay, good to know. And also, is it true that sometimes a patient, a teen, a child, might be on two different types of inhalers? You mentioned the rescue inhaler, and then of course the longer term type use.
Maintenance or controller, absolutely. And sometimes we'll see that, and you'll see even inhalers that have a combination, for instance, an inhaled steroid and an inhaled long-acting bronchodilator. And those are really meant, again, not for acute symptoms. So I'll tell patients, this is not the one you pick up when you don't feel well. That's still your albuterol. This is the one you're going to use every day, and whether it's raining, whether you feel well, you don't feel well, this is really meant to be your maintenance. And if you're needing to use your albuterol more, for instance, because your maintenance is not controlling you, and you need to step up your action plan, again referring to the action plan, that's the time when you then should be communicating with your doctor if you're stepping up your action plan and your controller medications are not really getting you enough relief, and you need to use your rescue medications more often. So it's an important distinction to make. We want people to use the right medication for the right reason, and to gain control, use the controller medications well.
Okay, and as you just mentioned, very important to understand the difference between these medications and ask your doctor questions, which is for which situation.
Absolutely.
Okay, and speaking of that, let's kind of start to bring things home now, if you will. And we've talked again a lot about allergies, asthma in kids and teens, and ways that parents and even people at school can help them manage these conditions. So let's start again, doctor, by when is it time for a parent to bring their kid to come and see you and find out, are they suffering from allergies? What's going on? Why are they sneezing all the time? Why are they coughing all the time?
Right, so it's very important when you're not sure what's going on. A lot of times you'll just think they have a cold, right? So when you're not sure what's going on, or even if you're kind of sure, but you want to really get an idea, especially with younger children, well, how much of something can I give them? What's right to give a younger child? Those are all important times to double check with your doctor, bring them in for an evaluation. What may seem like a simple cold may actually be a cold that's been exacerbated by an asthma attack. And what you may think is wheezing may be, especially in younger children, just a lot of upper airway congestion. So either way, we can help rule things in or rule things out, but we can always give you that opinion and expertise as to not only what's going on now, but in big picture, how are ways we can manage this, and if it's asthma or allergies, help prevent this.
Okay, and again, just talk a little bit about some of the testing that can be done to really pinpoint what is happening in a kid, a child or a teenager who might be going through some of these symptoms.
Sure. So even though you clinically can suspect the asthma and the allergic rhinitis and the allergies, there is further testing that can be done if it's needed. So things like pulmonary function tests, so breathing tests that can be done to help determine is there an obstruction that can be reproduced or that we can find on expiration. When you're trying to breathe out, it takes a lot longer. So things like allergy skin testing or blood tests also can be helpful in pinpointing certain allergens for people that are having frequent triggers or unclear triggers. So there's definitely ancillary testing that can be done that can be very helpful and further guide the therapy of your child.
Okay, and once the testing is done, if it is determined that you're dealing with asthma, again, at home, I love what you said earlier about having the red, yellow, and green zones established for the action plan. So just remind us again about why it's important to put that in place and what it's about.
Well, I think it's important because not everybody stays cool in an emergency, and not everybody stays, knows what to do in the setting. And so I think if you have something planned ahead of time, it's always easier to know, oh, you know what? You've been coughing a lot and you've had to use your inhaler 5 times this week. You know what? Let's see what your peak flow is. So whenever you kind of have that plan in place, it becomes second nature, or hopefully it becomes more second nature, that you're able to kind of institute that. And sometimes, like I said, you can stop a mild attack right where it is and not have it progress to the point that it gets worse. And now you're missing school and you're having to go to the ER at 2 in the morning because you're having a bad attack. So again, it's so vital and important with any illness, right? But really, ideally, with something like asthma, that you can take certain steps to kind of have that plan in place, review it, make sure it works for you, and review it with your doctor to make sure that that's not only appropriate, but also that it's something that you're actually able to do.
Okay, and we talked about it at home. We're going to have a plan at school too, but I think what we want to leave people with today is this is manageable, right? We just want parents to know you can get this under control.
Yes, asthma can be managed. I mean, there are sometimes going to be limitations with flare-ups, just like allergies, but it can be managed, and we shouldn't have that message be that, oh, I have asthma, I can't run, I can't play. We want our kids to be active, we want them to be healthy, and we definitely think that this is something that can be done.
Absolutely. They'll have a good quality of life as they grow up, and especially with help from you, Dr. Hiriart. We've learned so much from you this hour, and we thank you for joining us on the show today.
Thank you for having me.
Absolutely. We'll see you again. Well, that is all the time we have for right now. Thank you so much for watching the Health Channel, All Health All the Time. And when you're not watching, be sure to check out the website, allhealthallthetime.com. You can submit questions for Dr. Hiriart and the other experts here and learn more about a variety of topics on the Health Channel right here on South Florida PBS. I'm Laura DeAngelis. I'll see you next time.